So this one's actually really interesting to us because, there's a lot of like speculation that these environmental factors can lead to myeloma. And, so we wanted to look at that. The hard thing is that it's a hard thing to capture because patients don't know if they were exposed. So we may be missing out on a lot of patients that were exposed. One example is Agent Orange. There's a lot of patients that were never told that they were exposed to Agent Orange. And pesticide as well. They may have lived next to a farm or an area that had a lot of pesticide usage, and they just weren't aware of it. So with that aside, we thought this would be an interesting question to look at. And so when patients join HealthTree or when they sign up for it, it's not exclusive to a certain subgroup of people. It's if you have multiple myeloma, you can, or a precursor, Smoldering or MGUS, you can join. And so when they sign up, they ask some questions such as their environmental exposures. And so these are patients that indicated that they believe that they were exposed to pesticides. So we had two groups, and what we found is that, so we looked at groups that were exposed and then groups that weren't exposed. And we found that there was actually a trending difference. So it wasn't quite significant. I think the p-value was like 0.17. So it was kind of trending to a significant level, but not quite. But we found that males progressed faster from MGUS and Smoldering to multiple myeloma, regardless of whether they were exposed or not. And so I think that's kind of common knowledge. I think it's known that, when you're not exposed, males just kind of are diagnosed more with myeloma. They progress a little bit faster. But what was interesting is that even with exposure, males progressed even faster. So males progress faster than other males not exposed, and then progress faster to females. However, what we also noticed was that females' exposure were actually delayed. So their progression was a little bit longer. So it took longer time for them to progress. And so when we looked at their chromosomal abnormalities, we found that females had a significantly higher expression of deletion 13q. And I think I remember looking at the literature to see if maybe it's known that deletion 13 could be like a protective mutation or chromosomal abnormality. And I think there was some inclination that there were some reports that said that, yes, that having a deletion 13 could be protective. And so that's what we also concluded, was that these females that acquired this mutation, sorry, I use it interchangeably, I probably shouldn't. So when they acquire this chromosomal abnormality, their progression is a little bit slower. So we feel that this could be a protective mutation. Now, it's kind of funny to look at, because when you say if you have a deletion 13, what you're really saying is that you don't have a chromosome 13. So with the absence of chromosome 13, then 13q to be precise, it seems to be protective against pesticide exposure and progression from a precancer to multiple myeloma. So our takeaway was that pesticides may not be a tumor initiator, but it definitely does seem to be a tumor promoter, especially in regards to males.